We have to make sure that the politicians are held accountable.
Every administration had the ability to put a ban on asbestos.
When it comes to asbestos, it really is about power, money, and politics.
We have a little bit of extra time now, and so I think I'll open up the floor for questions and answers.
Well, first of all, how many of you want Dr. Flores to run for president? Wow. My question feels very small after that presentation. As some of you may know, I lost my stepfather to mesothelioma in 2004. He's very much missed, and of course Doug Larkin was my first husband. I was his first wife, and we miss him very, very much. And so the death of my stepfather has not gone, you know, it has purpose, which is amazing. But I want to tell you a story that's not related to that. I had a friend who worked at the Newport News shipbuilding plant, which is where my stepfather worked and where he was ultimately exposed. She and I met for lunch while her own father was suffering from lung cancer. And when we got together, she said, you know, the reason why I was working at the shipyard myself, one of my jobs as an admin when I was going to college was to shred all of the workers' files. In turn, her father passed away from lung cancer a year after my stepfather died. However, and this is a big however, comma, it was never linked to asbestos, although he worked in the shipyard as a manager his whole career. So my question for the panel is, we talked a lot about statistics, we talked a lot about linking asbestos to disease. But what can we do when we don't know what we don't know? If a man who worked in a shipyard where he was exposed to asbestos his whole career did not know that his cancer was most likely caused by asbestos, how do we close that gap? It's not just about improving reporting, but about improving knowledge. Are there blood markers, are there tests that we can actually do that can link asbestos without qualitative knowledge?
Here, I'll try and answer some of that. That's a great question, you know, because it's interesting. The burden of proof falls on the victim.
It does, yes.
And it's very difficult. You know, it's easy when you have a CAT scan that shows some calcifications. You can say, look at that. And sometimes you even have to biopsy it. So it's horrible. You have to put the patient through a procedure to actually show the link. And I don't have a good answer on how to figure that out, and that's part of our problem, is that we need to flip it around. We don't have to prove that. You have to prove to us that that didn't cause it, because we have so much proof that shows that link. And if there was asbestos there, number one, you know that it's being covered up because they're going to lose money on it. And so it's important, I think, from that end for them to prove that asbestos was not there, which is highly unlikely. So as far as biomarkers are concerned, yes, there are biomarkers. They're not perfect. And, you know, their product is doubt. They want to sell doubt, and they will continue to do that, and they're very effective with it. We've seen it with the tobacco industry, and we've seen it with the asbestos industry. So it's a great question. I don't think there's a good answer.
But I think you're right. I think education is a very important part of the answer. Educate the public, educate workers, educate physicians. Physicians need to know that when you ask a patient, do you smoke, which is one of the first questions a patient gets asked, and that patient says yes, it's game over. You know, no matter what kind of respiratory disease the patient has, except ironically maybe interstitial fibrosis. And so physicians need to know to keep pressing and keep asking. And they need to understand the medical legal system. And they need to put all that information in the medical record. And that will help. I mean, it's not the entire answer. There's a debate raging within the scientific community, or maybe raging is not the right term, but there are a group of scientists who believe that the best way to determine asbestos exposure is to do an invasive procedure, take out some of the lung, look at it, and see how many asbestos bodies are there. There is another contingent which says, oh, you don't have to do that. All you have to do is take a good occupational history. And if you've got somebody who has interstitial scarring of the lung, and they have a heavy asbestos exposure, well, it's asbestosis. You don't need to go in and take out the lung and look for asbestos bodies. So, you know, this battle rages in all different sectors, including the scientific sector. But I think one of the keys is education. It's a key.
Thank you.
My name is Al Rexroat, and I represent mechanical insulation contractors in the U.S. and Canada. And I want to talk a little bit about what you all have been saying. We have to be our own advocates for this. I've been living with cancer since 1986, from non-Hodgkin's lymphoma to breast cancer to asbestosis. I was just at my doctor's office not even a month ago, and I had to go through this litany of exposure from 1964 till today about asbestos exposure. Now, this man's known me for a long time, but he had no idea of that exposure. How would you get what I've got without the exposure? So what I'm saying to everybody is, it's our duty to make sure these people know what our life is like, what's been in our life, and what's caused what it's caused. And I totally understand how people wouldn't know. But for those of us that did, we shouldn't have to go back and reinvent that wheel, in my mind. Thank you.
Thank you.
So Kim is absolutely right. There is a knowledge gap between patient and physician. And I would like to urge and work with all of you, and I think inviting your colleagues to watch some of these videos helps. It's very hard for patients to penetrate into the physician world, and it's also very hard for us upon a diagnosis to understand what to do. So I think there is a collective knowledge gap here, but I'm hoping that our new website, there is a health-based component on that, and maybe we can add a medical and occupational section so we can get people to the website for knowledge, not frighten them. But when people ask me, what should I do? My child played with that toy. Will Henry get sick? The best thing that we have is for them to have a conversation with their physician and for them to keep good records for themselves. And that's really not good enough for parents, but that's all we have. So maybe we can collectively come up with a better process, because Kim is right and all of you are brilliant, and we need to facilitate that better sharing and interaction, in my personal opinion, and the experiences we get at ADAO.
I also think the occupational history is getting more difficult to take as the practice of medicine changes, because when I first started, I had an hour with a patient. When I retired from the MGH, I had 15 minutes with a patient, and the electronic medical record is now everywhere. There's good news about the electronic medical record. There's bad news about the electronic medical record. The bad news is that physicians don't have time to take a detailed history from their patient, whether it's an occupational history, an environmental history, or even a medical history, in my opinion. Are there other questions? Yes.
Yes, hello. My name is Eric, and I come from Belgium, and I have a question for John. Yeah. My lungs are full of asbestos because my father worked in the asbestos cement industry. We have recently won a court case, and we have decided with my family to go public and name the firm Eternit. Yeah. I wonder why, in your case, you have decided not to mention the firm, because people have to know who is a culprit. We should not hesitate anymore to put these firms, the name of the firms, on the public streets, you know, and name, as we say, a cat. Yeah. That's an expression in French.
Yeah. Google me, and all that information is there. There were multiple firms involved. My father's company, there were other companies in addition to that. So finding the information is not terribly difficult. I guess in a way I'm a little uncomfortable, not about, I mean, I don't care about the company. Ironically, I actually work across the street from the company, and every day I leave work, I drive out and their headquarters, their corporate headquarters is right across the street. So I'll say the name, Eaton. You might have heard of them before. They've been around a long time, and they're part European as well. So, but there were other companies involved as well. And in fact, the companies that we ended up settling with, working with, are the product manufacturers. There were almost, I think, 4 or 5 of them actually. And yeah, it's tough. It really is. A lot of it has also to do with just. My case ended up becoming in Ohio extremely public. We had the highest, at the end of the trial, we had the highest, it wasn't the settlement, but the highest judgment in the history of the state of Ohio. It was quite a staggering number, and the company that was left were really embarrassed, and it was very nasty. And so, yeah, it's not too hard to find information about it, but I agree. I wish we could talk more about these kinds of things and expose the companies. But the thing is, these companies are already exposed. I mean, you mentioned Johns Manville, for instance. I mean, they're notorious. I mean, that name's been out there for decades.
Yes, but John Mansfield went bankrupt. You know,
absolutely.
They closed. Eternity is still in business.
Yeah, absolutely.
After asbestos was banned in Belgium in '98, you know, they opened factories in India, you know, so.
Yeah, and of course the Johns Mansfield Trust is a big part of the, for claimants, it's a small section of that because if you're exposed to asbestos, generally you can get claims through the Johns Manville Trust.
I think on this note, we're going to have to stop. So maybe if you have questions for the panelists, you could take them during the lunch break. It's a fabulous panel, and I want to thank all of you for participating.